just to wrap up, how about we talk about single site and where you think the future of robotic surgery is going?
The future may be out here in the audience. We may have some future surgeons, and their device will look totally different than ours. It'll be spectacular. And I just wanted to point out that there is a robot set up behind us, behind the audience, that anybody out here can go sit down at the console, and you can see what we see, and you can practice with the instruments. So that's available this weekend right here. In my field of urology, it started off with prostates. It really revolutionized prostate surgery. And then we went to kidneys and both malignant and benign situations. One of our biggest surgeries we ever do on someone is to remove their bladder for bladder cancer. And that may be commonplace robotically one of these days. It's still really challenging now, but I'm sure that'll be increasing in the future. I don't know about other urologic procedures so much, and I'm not sure my field will do much with the single site. I'll let one of the other guys explain that, but I'm sure it'll keep getting better and better.
We don't have Dr. Sams in here, but for gynecology, single-site hysterectomies is going to become probably very popular. You go in and have basically no incision because it's all hidden in your belly button. Some of that we will probably do with gallbladder, take a lot of gallbladders out, but it has to be certain patients that you do that on, not just anyone. Single-site in the next few years there's going to be a different system than this, that's even smaller, tiny instruments, has a lot more advances, and it's going to kind of keep revolutionizing what we do and how we do it. So in the next 10 years, we may be doing all our surgery this way, except for sometimes you got to make a big incision. So it's advancing very quickly. The good thing is I think we've stayed, with the most up-to-date stuff. So that's about all I got.
Yeah, I already do single site. It's about a site about this long. But people are doing single site for thoracic surgery with video assisted, comparable to laparoscopic. And I'm sure they will be with robotic as well too. It's a little different with a rigid chest with ribs and all too, but you will see people do that. I think the future is going to be just more complicated procedures done with robotic surgery. They're doing esophageal surgery with esophagectomies for esophagus cancer. And more complicated procedures. So I think I think you'll probably be including some more of the people who aren't included now because of tumor size, that sort of thing, in thoracic surgery. But it definitely is the future for thoracic surgery. There's no doubt about it. So.